Good morning, everyone. Welcome all of you joining the virtual presentation organized by the Occupational Health Center. Today, the topic is about the grocery retail surviving the past 7 months. This morning, we are so pleased to have Ferris and Geoff Bergen from they are the union representative from the United Food and Commercial Workers Union, Local 832, to do the presentation for us. We would like to begin by acknowledging that we are on the Treaty 1 territories, the traditional territories of the Winnipeg, Greek, OG Greek, Dakota, and the Indigenous people, and the homeland of the Métis Nation. We respected the treaties that we were made on these territories, and we acknowledge that we were all treaty peoples. At the OHC, we commit ourselves to a process of affiliation with Indigenous communities. So for the audience participation, you all knew that we all mute the participants. Would you please keep your microphone mute during the session? To ask question and put the comment, please put your question in the chat box section on the right side of your screen, and the presenter will try to answer them in order. We may not able to answer all the questions in the Q&A session. Will you please connect with us afterwards to follow up? Our session will be recorded and posted on the social media and our website soon later. So Occupational Health Center is now currently located in 167 Sherbrooke Street. We are the nonprofit community health center funded by the Winnipeg Regional Health Authorities. We provide the services to the Manitoba workers with work-related health issues and work closely with the Joint Workplace Health and Safety Committees for training. Please visit our website to getting more information and resources. Now, please join me to welcome Kim and Geoff.
Hello. Good morning, everyone. Happy Friday. Lovely to see some snow this morning. Just quickly introduce myself. I'm Kim Ferris. I'm one of the union reps with UFCW Local 832. I've been a staff rep since 2008. Started in retail, I've had a few territories since then, and then went back to a retail territory last year, June of 2019, just in time for a pandemic to start. So it's been quite interesting. Primary work sites in my territory are Sobeys West, which is the Safeway stores, as well as Red River Co-op, and also some co-ops outside of the city, and Freshco as well. So we have quite a lot of stuff going on. So, and I'll pass it over to Geoff.
I'm Geoff Bergen. I've been a staff rep with the United Food and Commercial Workers since April 2016. I also worked for the Loblaws company for 8 years in grocery retail prior to becoming a rep. And with the Safe Workers of Tomorrow, I see some of my former colleagues here. So I represent Safeways with Kim. We split the Safeways, and I also represent Superstores. I split those with my colleague Roberta Hugervorst, who could not be present today because she's also the Stella's rep. And if you're following the news, which I hope you are, we're in a fight with Stella's. So she is occupied with that. And I'll be addressing kind of what happened at Superstores, while Kim addresses the other side today. So thanks for joining us this morning.
Yeah, thank you. Excellent. So when Geoff and I sat down to talk about, sort of discuss what our presentation was going to be, we really wanted to be able to give a perspective of what it was like being a rep during the last 7 months, and what it was like hearing from our members. Obviously, we weren't in the stores. There was quite a period of time where we weren't able to actually physically go visit the stores due to our own protocols, but it was quite an interesting time. The first 5 weeks when things really started picking up here in Manitoba and Canada, the work was unbelievable. It was super high stress, and we're going to talk a little bit about that, but it was living through our members as well and trying to help them best. So we thought the best way to give the presentation would be to sort of give our perspective from a rep standpoint, as well as what we were hearing from our members. So I'm mostly going to speak on Sobeys West Safeway, as well as Red River Co-op. Geoff's going to give some more information about the Loblaw situation. I think they proved to be a little bit more of a challenging employer during the whole start of the pandemic up until this point. But I'd have to say Safeway, Sobeys West started probably late 2019 with pandemic preparing. And then early February, they started notifying the union of just some of their plans. When you look back at how things have changed since then, those first bulletins that were coming out of us, just make sure you're washing your hands. If you're traveling to China, make sure you notify your management. It was very, very basic. It's amazing how much information has come and changed in that period of time. And Red River Co-op was very similar. They, they weren't quite as proactive as Sobeys was, so to say. They sort of kind of jumped on the bandwagon a little bit later once things really started picking up in Winnipeg. But, and that's kind of where things went. It evolved really quickly. As we all know, everything changed on a day-to-day basis. Around the beginning of March, when things really started picking up, that's when we started seeing more PPE coming in. We were getting bulletins daily from the company, as well, sometimes even twice daily, depending on what the announcements were from the government that day. So it's constantly changing. And I think some of the biggest challenges, which we're going to talk about in a little bit, was trying to keep up on that, but also trying to keep the members informed, because we would get the information pretty much as soon as the company would, because it was just, they were sort of waiting for that. So any type of updates that would come, they would notify the union, and then we would try and communicate that to the membership as quickly as it could, as well as the company was doing the same. So it was a lot of trying to stay on top of it, but at the same time, there wasn't really much we could do to get ahead, because we didn't have the information, because it just changed so often, and the employers didn't have it either. So, and then things just really quickly progressed from there. They had, the PPE coming in. First it was the gloves, then we started getting issues with the masks. Then, it was bringing in the plexiglass barriers. And it was interesting, as things started progressing, we noticed patterns in the employer where they all wanted to wait to see what the first major employer was going to do. And then once they did that, then the other ones would follow suit within a day or two. So it was, and it's kind of, that was an interesting part, just because we thought, well, everyone has to do this. So I don't know why it seems like they're waiting for the first employer, for someone to lead the way. Just do it. But it did eventually get going, and it certainly was, I have to say Sobeys and Red River Co-op were quite good. Like I said, they were very proactive when it came to things. They were quick to get things done. They were quick to communicate with their employees, our members, as well as quick to communicate with the union. But I do know that Geoff had some challenges with Loblaw. Jeff and Roberta, I should say, there were some challenges there. So I don't know if maybe you want to speak to that, Geoff.
Sure. So I like to preface by saying that, everyone, this in March and early 2020, this was an evolving situation, and everybody was trying to react their best. But where Safeway and River Co-op would provide us with safe operating procedures, new policies and measures that they're putting into their place, we didn't get that kind of information flow from Loblaw's management and HR. A lot of that came from our members, our activists, our health and safety committee members telling me and Roberta what's going on, what changes are being implemented. So I'm just kind of like to go over my timeline of what it was like for me, and some of the stuff, a lot of stuff Kim, Roberta also shared. So, in the beginning of March, we started getting a lot of questions and concerns. There's a lot of what ifs, right? It started with what if questions. What if this happens? What's going to happen if we don't want to come to work? What if we don't want to pack groceries or touch people's reusable bags? What's going to happen to us, right? What's going to happen? It was a big question we got. And then as March goes on, and it becomes apparent that this is not going away, and this is going to be a long-term issue, concern turned to fear, starting getting a lot of scared people calling us. Lots of questions on how to take a leave of absence. And I have to say, all the employers we dealt with were very good on allowing leave of absences, whether it was to attend to children because their schools were closed down, they had family members with compromised immune systems, they were just not comfortable going to work. So that was really good. And what you got to understand is, when there's these people asking for questions, they want to know what's going on, there's a lot of fear. You're also a human being living through this yourself, we the reps, wondering how it's going to affect us, our families, our friends, our loved ones. And you're also internalizing and hearing all day from members who are rightly concerned and coming to us for answers. And you want to provide those answers, but they were so hard to get in the early days of the pandemic. Things were unfolding really fast. tons of unknowns, like I said. Often when members called, we knew as much as they did. We're all watching the news. What was very frustrating at the start was all the changing information, right? It's just changing daily, and we're trying to stay on top of that, as Kim was saying. Gloves are good, gloves are bad. Masks are good, masks are bad. Sanitize, how much? Too little, too much? Are people getting sick from the sanitizer? That was the kind of thing we were dealing with. And then once the state of emergency hit on March 20th, you know, there was a feeling of panic in the air. That's when my phone was ringing off the hook. You know, you would be on the phone and then emails would come in, you respond to the emails, your phone is ringing. While you're on the phone with people, your voicemail is filling up. At one point, it was I was getting a lot of calls from one store that was particularly upset with how their store was reacting. And in my own frustration of just getting bombarded, I called my HR contact and I was like, look, you need to do something. You're gonna have a walkout on your hands. It was quite fast paced in those opening months. Had my hair in my hands a lot. That's why I grew it out. So I had something to grab. So then shortly after the state of emergency, we start seeing the stores all one after another implementing some sort of hero pay, quote unquote hero pay. It's usually around $2 extra an hour. And like Kim said, they all waited for who was going to do it first, right? Once one did it, then they all started implementing it. So after hero pay, the state of emergency, this is when we started seeing new safety measures and protocols being put in place. Like the plexiglass barriers started being installed on tills, at fresh department counters, at customer service counters. Lines are put on the floor. Stores started counting how many people were coming in. But then, of course, now there's a lot of concerns from members about the safety measures. Complaints that the ventilation was poor in the plexiglass. You know, valid. They have an opening above them and to the sides of them, but they're still, still feeling confined. When you're using a lot of a lot of sanitizers, cleaning chemicals, a lot of our members felt congested or stuck in these plexiglass boxes. So we were dealing with a lot of those. Some people felt like the spacers on the floor were not far enough apart. I had members calling me to tell me they had measured 6 feet. It was not 6 feet. So having those conversations with HR, working that out with the managers of the stores, and they did more or less respond pretty well to these concerns, because they realized, you know, our workers are concerned. We should listen to them because we want them to keep coming to work. There was quite a few people not coming to work in the beginning of the pandemic. So, you know, at this point, and I know there's a lot of people there's people here from various workplaces and who do different things. So again, everyone was trying to figure this out the best we can, but it became very frustrating for us as reps and the members was we were constantly being bounced around looking for answers. We call workplace safety and health. They told us to call the public health authority. We call the public health authority. They'd send us back to workplace safety and health. Getting an answer was quite difficult. We were frustrated. Our members were frustrated. The number one conversation we started having with our members and trying to figure out how it would work in a pandemic situation, working for a large retailer, was the right to refuse. A lot of members were like, well, I want to use the right to refuse. And we were being told, well, unless there's a confirmed case of COVID that you know about at your store, it's not a valid work refusal. So we had a lot of conversations with our members, making sure they understood how that worked, trying to make sure we understood it ourselves so that we're giving the information correctly to our members. The second thing that became very frustrating for us as reps was the lack of hard rules from the government on how a large retailer should operate during a pandemic. There's guidelines, they were vague, there's best practices. But the problem with best practices, it's left to interpretation, a gray area. When there's gray area, some of the stores they got an inch, they took a mile. What I mean by that is, so Superstore said, well, we'll only let in 25% of our fire code. Now, when their fire code is a couple thousand people, because it's per square inch, right? Per square inch of the store, that's still hundreds of people entering the store. And the way superstores are designed is you're kind of funneled into the produce department first. So getting a lot of complaints, concerns from our members in produce departments at those large stores saying, we feel like we can't space out. We feel like we can't get away from the members. And at that point, I was just telling them, like, look, if there's too many people on the floor, leave the floor. And if your manager has an issue with that, tell them, look, I'm just practicing social distancing. I'll go back out there once the store clears out a little bit, or we get the numbers in here under control. Largely that went okay, a little bit of pushback sometimes, but we were able to deal with, pushback from the employers, but we were able to deal with that. So then once things settled down, a lot of the questions turned to chemical use, sanitizer. Chemicals were hard to get. Sometimes they're making their own sanitizers based on what they found online. This resulted in over mixtures, too much chemicals being added, people thinking more chemicals equals more clean, or more spraying of chemicals equals more clean. But really that just increases your exposure to chemicals when you're using more of them.
Yeah.
Right.
So really quickly, Geoff,
yeah.
we had some similar situations. I know Loblaw was sort of kind of doing their own mixture on sanitizing products with bleach and whatnot, but we had Safeway and Red River Co-op that were using a product called Triple Play, and they brought that in quite early before the state of emergency started. And and then we did find that there were situations like that where people were over sanitizing. People were complaining about, their eyes were sore, their throats were sore. When we looked into it, it was because people were spraying absolutely everything. They were overusing the product. And so, we were able to deal with that, but those are just some of, in and amongst some of the other things that have come up, and the employer was really great to respond to them as well. They would bring in Ecolab and have them check the calibration on the dispenser. We had some HVAC people come in and fix some stuff that was going on. So they were quite responsive, but we did find that a lot of that had to do with overuse of the product. So, ensuring that the employer also gets the information out there a lot more efficiently than what they were, so people know how to properly use those cleaning solutions.
Yeah, so one case I had, so because cleaning solutions were hard to come by, Superstore was mixing their own bleach sanitizers themselves. So getting a lot of complaints about irritated throats and eyes, pardon me. So when I investigated that, what I found was that it was supposed to be two milliliters of bleach to 1 liter of water. And some instances, people were pouring in a half cup or more, again, thinking more is better, right? It's going to make a cleaner workplace, which is not the case. That's not safe use of a chemical. So we had a lot of conversations with members, committees, management about material safety data sheets, making sure everyone knew about how to properly mix a chemical, what safe exposure limits were. We started asking managers to do the mixing instead of colleagues, just to make sure it was done properly. So then as July goes, as we go into the summer, Hero Pay is wrapped up. This, of course, upsets a lot of our members. The pandemic was not over at that time. It's not over now. So then over the summer, things got quite lax. Some companies, like Safeway, did keep greeters at the door to sanitize carts, sanitize your hands, hand you a cart, and ask you to follow the lines in the store. Companies like Superstore replaced the greeter with a table that had a bottle of hand sanitizer on it and a cart wipe, if you so choose. And no more counting of the people entering the store. So they did maintain extra cleaning. More cleaners were hired. A cleaning service contractor was brought in to be walking around the store all day, cleaning high-touch surfaces like the freezer doors and whatnot. And PPE was now increased. There was a shortage of PPE at the start. We had people bringing in their own gloves, their own masks. Now gloves are widely available. Now PPE was widely available. And towards the end of summer, around the end of August, masks were made mandatory at all stores. But now we're well into our second wave now. But what's different is that a lot of the controls already put in place. The plexiglass shields are still up, and I believe they'll be up for a long time to come. There is a little bit of we've been through this before mentality from some members, like, okay, like, some of the unknowns that were gone are gone from early days of the pandemic. And then just the wide use of masks and safety measures that are now available. But now the concern is turning to members worried that, there's still those people, despite masks being mandatory, not wearing their masks when entering the store. We hear from a lot of members that they like the companies to not let these people in. And as much as we like that, I just think that's a recipe for altercations. And I don't want the task of policing who has a mask and who doesn't being assigned to our members, because I feel like that's just a recipe for a physical altercation or verbal harassment, which I, quite frankly, they put up enough with from a stressed out public who's getting fed up with the pandemic. We're all fed up with the measures, but they're there for a reason. And they're on the front lines of that. So I didn't want that any further. What I'll just say lastly is that UFCW retail workers and all retail workers have been living through the same pandemic as all of us. They have the same concerns for their families, their friends, and they have to deal with a public that's stressed out, like I just said. And it looks like we're in for a few more months of it. Hopefully it's only a few more months. I don't know, Kim, is there anything else you'd like to touch on the timeline of where we're at now?
No, I think that kind of brings us up to snuff on everything. And, I think maybe we can discuss some of the biggest challenges that our members have faced over the past several months. So, pardon me. I know, and with the retail reps that are at the local, right when things really started picking up, we were having daily Zoom meetings to just sort of figure out what our game plan was for the day. But the first 5 weeks of when we were sort of at the height of the pandemic here, our workload, it was unbelievable. And a lot of the calls that we were dealing with, we weren't dealing with violations of the collective agreement. We weren't dealing with disciplines. We were dealing with people who were afraid to go to work. We were more being counselors, for lack of a better phrase, as opposed to their reps. They would contact us. They're looking for information, but they just really needed somewhere to vent. And they felt that we were the best way to do that because, their store managers are right in the thick of it just as they are, right? So they may not necessarily get that same level of compassion as they would from us, but a lot of the calls were simply just trying to listen to our members and let them get that frustration out and let them cry and let them express their fears and give them the best reassurances that we could and, follow up as best as we could, send those emails out. We did a lot of email blasts to our memberships. We did a lot of phone blasts as well. We would try and get as much information as we could to them. And we know that it was appreciated because we would hear from the members. But yeah, for those first 5 weeks, we didn't deal with any type of issue that was related to a collective agreement or in the workplace other than just really trying to be an ear for people and listen. And it was unbelievable. The workload was, I've never experienced that before. It was insane. Yeah. And just trying to, and and Geoff touched on some of the challenges that we had as well, was trying to get information, right? We phone public health tells us to phone workplace safety and health. So trying to stay on top of that as well. And so as things sort of normalized out after those first 5 weeks and then, started changing with some of the restrictions and whatnot, the members kind of got into a new normal with all of that. And then of course, they took away the hero pay, which again, it was one employer was waiting for one to kind of do it, but they sort of did it all at the same time, which was questionable. So, and that has brought a lot of frustration. And so as their union representing them, we've been trying to put pressure on the employers to reinstate that extra pay because there's less restrictions now than there were at when the state of emergency started. And there's still that same exposure. If not, it seems to be increasing at this point. And people are still really scared to be at work, but they're kind of winging it because now they've come into a routine, so to say. And what's really interesting is I brought this up, I chatted with Geoff and some of the other reps when it first started with the availability of masks. Employers couldn't get the masks fast enough. They would call their suppliers. Suppliers would say, you know what, we've had to prioritize these for healthcare at this point. We'll get you what we can. So, members were encouraged to bring their own masks and whatnot. Everyone wanted to have a mask. They wanted to have the gloves. They wanted to have everything. Then when the government came in and mandated masks, strangely enough, we're actually getting calls from members now saying, do we have to wear them? Is it absolutely required for us to wear them? So it's strange how some of the frustrations from our membership have changed over the course of the last 7 months, but it's all there for a reason. And some of the other frustrations that we've been dealing with is near the beginning was management was great. When it came to difficult customers, I had, some of our members, one of our members who works out in Lorette, she got spit on by a customer. You know, just those folks who don't necessarily believe what's going on out there. They don't feel that they need to wear masks or take any extra steps, whether it's for themselves or others. That's never going to change. But management was really responsive at that point. They would not hesitate or be reluctant to ask a customer to leave and not come back if they're being rude and disrespectful. Now we're in a situation where management doesn't seem to be as involved. They seem to just sort of sit a little further back and just kind of let things happen. A lot of the members know not to address those customers and just kind of let them go, but it does create some frustrations for them because there's expectations on them as employees. Why can't the same expectations be there for customers? So that has definitely been an ongoing challenge throughout the entire past 7 months is customers and just how they've treated some of the workers in retail. That's definitely been difficult. So
Yeah.
did I miss anything, Geoff? I probably did, but
that's okay. Building on what Kim said, and a question we got last night is mental health support and the anxiety that was going through people then and now, right? As we go through this, we are not trained mental health professionals, but as Kim said, we were a sounding board for a lot of our members who just felt like they had nowhere to go, and they just wanted someone to hear them. And that's what we would do. We'd be that ear. And then offer information when we could. So some of the biggest challenges that I want to highlight that I feel like what we need to look at going forward is, so there was no hard and fast rules, like I said in my timeline, of how a major retailer should handle large amounts of crowds. I don't know if this was a reluctancy to impose rules on major retailers because how important it was for people to continue to get groceries and have a supply of food. There was just, quite frankly, too much of a gray area. And when there's a gray area, the employers have time to play around with it. And, you know, they follow best practices and guidelines until, and quite frank, let's be frank, until it became a hindrance to profit making. You know, if the crowds were too far lined up outside the store, I had reports of managers just saying, let them in, just let in the crowds, right? You know, and stop counting and letting in the members, or stop letting in the customers. I apologize. Another big issue was lack of understanding of how the virus spread in the early days of the pandemic, and that caused misinformation to spread very quickly. So as Kim said, we were constantly trying to stay up on info. As soon as we had info, whether it was federal assistance, whether it was changes to anything, or PPE changes, we sent out email blasts, phone blasts. We called our shop stewards, we called our health and safety people, making sure that they're armed with information. That was probably the best thing we could do. That's the best thing we could do at the time, was making sure that they had this info, and that they knew the correct info. Another big issue was the right to refuse, as I touched on in my timeline. There's a lot of misunderstanding on how it's going to work. The right to refuse pertains to immediate risk. You know, it was hard for members to understand why, you know, we're dealing with the public. We don't feel like these measures are enough. I don't want to use my right to refuse. So there's a lot of conversations about that, understanding that. And then another big issue was sick pay or leaves of absences. The CERB helped a number of workers in the first wave, and that was great. But as we enter the second wave in cold and flu season, workers are being advised to stay home if they don't feel well, which is right. That's what they should be doing. But a lot of them have used their sick time up already. The CERB has wrapped up, and now they're left with the choice between, well, you know, I don't think I'm got COVID, but I'm not feeling well. Do I stay home? Do I go to work? I can't lose a paycheck. That shouldn't happen. It shouldn't happen. People shouldn't be choosing between their health, their colleagues' health, and a paycheck. So we need more paid sick days for workers, and assurances they'll be looked after if they're staying home to look after their health. You know, so those were the biggest issues and challenges during the pandemic for us. What Kim said, what I've highlighted. You know, just, yeah. Kim, anything else?
No, I think it's No, I think that kind of sums it up. And, it's kind of ongoing challenges now. And, it's also sort of back to regular business where, it's kind of a nice change of pace. Yeah, I get to file a grievance today. It's a little bit nice, but yeah, no, that kind of sums it up. And, now we're just kind of dealing with newer challenges. And I think, part of it was getting the information to our members. They wanted the answers that we couldn't get it to them fast enough. And we would contact the employer to say, hey, what's happening with this? And they would say, we don't even know, because we just found out about it too. We're trying to get it figured out. And, so it was, between some of the employers, there was a lot of good collaboration between the union and the companies to try and get it sorted, because the employers were just given these guidelines and they were left to sort out what it is they need to do. I mean, I know Geoff's experience with the Loblaw was different, but Sobeys West as well as Red River Co-op were extremely proactive. They were really responsive, and they wanted to do that the best that they could for their members, for their employees, it was nice to see. You don't have to worry about going in, talking to them and having to butt heads or have arguments with them, because this is just something that's going to benefit everyone, right? And it's going to make the company, well, I mean, obviously they're there to make money, right? So the better they can do for their employees, the better that the public will want to end up going in there. So yeah, I think that summarizes a lot of those challenges quite well.
One thing that's never happened to me before as a rep, and I've only been doing this for 4.5 years now, but is I've never had the general public calling me. And at the height of the first wave, I had phone calls from the public. Are you the union that represents workers at this grocery store? Yes. It was just like, do you know this is happening? Do you know like that these, and I would be blunt with that customer, and I would say, look, we're having the same issues getting these things resolved, the same concerns you have as a customer, we have for our workers there. And I would give them, complaint lines. I would tell them, direct them who to talk to. And, the public was on board. Every time I had a concerned member of the public call me, I advised what I needed them to do. And they're like, I'll do that for you. I can call these people, or I can call the complaint line. And because they honestly react sometimes better to their customers, which are never wrong, to the union, quite frankly. Yeah. So let's move into how health and safety was achieved during the pandemic. You want to start us off, Kim?
Yeah. I think, well, again, in some conversations Geoff and I had, we don't actually know if there was anything achieved during the pandemic. It was hard to, because we really just didn't get, it's so unprecedented, what has happened and what continues to go on, that we were literally flying by the seat of our pants. Like I said, trying to get communication between, whether it was from workplace safety and health or from public health, we couldn't really get answers from either one on what their position was when it came to a certain situation, or what's best way to go forward on this. I think that the employers did a fairly decent job on getting the SOPs out. And, I think maybe they could have communicated some of those better, particularly when it came to the sanitizing products, and I don't know if they just took for granted that people know how, but I know that with Sobeys West, the Safeway group, they communicated stuff quite regularly. Everything got posted in the workplace. It was communicated through all the different departments, but I think maybe in hindsight, there could have been more information or a little bit more hands-on for those folks who don't normally use those types of products, or some of the newer employees, because during the whole pandemic they continued to hire, right? So they had a bunch of people coming in off the street that didn't know a lot, so they could have maybe spent a little bit more time with some of those folks, because everyone's expected to do their sanitizing. I don't know exactly what we achieved, to be honest, as far as health and safety goes, to be perfectly honest. So just kind of
exactly.
Yeah.
We were putting our heads together over this question, and so those of you who know health and safety well, what do you do with a hazard, right? You try to eliminate it. That's the best way to deal with a hazard, not have it there. The hazard was a virus carried by people, right? The grocery stores need people to come through them to be successful, and people need groceries. You couldn't eliminate that hazard. So what's the next step? You engineer controls, right? Measures and controls. So plexiglass barriers were installed. Like we said, lines on the floors were measures. Increased sanitation were measures. But these are only barriers, right? These are only barriers to the hazard. The hazard is still there. And, with such large volumes of people entering the stores, only so much can be done to control that hazard. I mean, there's good guidelines. Tiffany will review those in a minute. But only so much stocking can be done overnight. You need cashiers. You need people. Produce is a department that's constantly restocked. It's also you can put out at 6 a.m. and hope it's good till 11 o'clock at close. Produce needs people on the floor. So again, you do your best with barriers and controls like increased sanitation. But that hazard's still there, and we've had, unfortunately, more positive cases in our stores than we did at during the first wave, with more controls and things put in place. But you know what really saw health and safety be achieved, when I really think about it, is workers' resiliency. It was the workers themselves. It was them putting their foot down, being like, no, I need to sanitize my workstation before the next customer comes in, right? Because that was one, for example, that was one of the measures. They would line up customers. When the till's empty, they would then move another customer to them. But again, as the store gets busy, as the crowds get bigger, they try to push, just a few more people through those tills, right? But it took members being like, no, I'm not taking another customer until I had a chance to clean my workstation. It's people standing up for themselves and knowing their rights, and knowing what's right, which what we try to give them, right? Knowledge is power. And so really, really, it's the workers. My hat's off to the workers. They looked out for each other. They achieved what they could through the pandemic.
And they really didn't get much. They didn't get pushback from management either when they stood their ground on those types of things. Whether it was taking the extra time to sanitize, make sure things were done properly, telling customers, no, I'm sorry, you have to wait. You're not coming through my line. In non-pandemic situations, if something like that were to happen, I would not be surprised if, someone said, hey, customer, you need to stay where you are right now. I'm going to ask you to come through my till when I'm ready for it. I wouldn't be surprised to see discipline come across my desk for something like that.
Right.
During all of this, nothing. It was management let the workers do that. And, it was empowering for them because now that gave them that little bit more of a sense of security and safety because they had a little bit more control in there. So, and they weren't afraid that they were going to be penalized for it.
We didn't see any disciplines for standing up to a customer, which typically, saying no or something other than how can I help you to a customer could get you, in a disciplinary situation.
Yeah.
All right. So for time, let's go to the end here. What have we learned so far, and what do we need to change going forward?
Pandemics suck. We know that much.
Yes.
I think some of the biggest things that we've learned, again, when we were sort of discussing this is we really need to work on getting language negotiated into collective agreements going forward that deal with pandemic or emergency situations. We have small snippets of language, where it refers to an instance of force majeure. I'm not sure if a pandemic would refer to this, but we need, because Geoff was making mention yesterday, well, it's Manitoba. We could get a crazy blizzard. We could get an insane ice storm. That doesn't always happen, but when it does, what do we do in those types of situations? So we need to look at trying to negotiate some type of language about emergency situations or emergency response. I'm not sure the best way to phrase it, but and then also we need to look at trying to get negotiating language that gives those extra financial incentives to the workers, because they really are, they really put themselves out there. I don't think retail members ever viewed themselves as essential workers until the pandemic came into full swing. And, as members of the public ourselves, we relied on those services, even though we were working from home and not really going out and doing anything, we still relied on those services. And, as can't thank them enough for all of the work that they did, and for everybody that continued to work entirely through that, working with public. It's incredible, because when you heard the fear from the members talking to them, I can't imagine, being in their shoes, having to do that every single day. I think some of the biggest things for sure going forward is we need to try and get some language into collective agreements that can address with these, because, when they took away the hero pay, we didn't really have anything we could sink our teeth into to try and fight back, other than, send letters, try and put pressure on the companies, on the government to say, let's get this going. Workers are still working, they're still exposing themselves, they're still at risk every single day, and you've taken now this away from them. So, and oddly enough, they're cutting hours in retail too, which is strange. Yeah. So
what I'll say, and this isn't health and safety related about what we learned, but we learned that grocery store workers, and I'm not throwing shade at any other essential worker who's viewing this, but grocery store workers kept us going. They often called replaceable or unskilled workers. That's just 100% a fallacy. I don't believe that. If that's the case, how come when they had to hire people because people were staying home for leaves of absences, it was a revolving door, right?
Mm-hmm.
No, people didn't stick around. They're constantly hiring, but it was, it takes a lot. It does take a lot to get good at that job and be efficient. And I think the companies, I hope they realize it too. Grocery store workers, I gotta say 100% deserve everything that they're entitled to, whether that's $2 extra permanently, which we are advocating for. And if, I have to ask the people here, if you see this, in the next few years, if you see a grocery store worker fighting for a better contract, for some of the stuff we're talking about, for increased pandemic protections or emergency protections, I ask that you support them. I gotta ask that, because they prove their worth. They've always proved their worth, but this pandemic, I think, showed it to the public. The other thing is we need to look at, increase sick time, access to sick time provincially and federally, paid leaves when it comes to emergency situations for dealing with the family, increased mental health support. Those things would go a long way. We have a sick pay language for our members in our collective agreements, but the sick pay language we have is not meant to cover 2 weeks to 3 months off work. It's 7 days in a year, right? And you have to earn it too, through working. So having access to additional sick time, maybe it's accessed only during emergencies. That's stuff we have to look at in our collective agreements, in our provincial legislation, in our federal legislation, and mental health support going forward, because we're still in this pandemic. As we come out the other side of this, who knows what we're going to be dealing with in post-traumatic stress, anxiety disorders. We deal with so many members who are just anxious. That's why I can't go to work today. My anxiety is too strong. We hear that more than I'd like to hear. It's unfortunate. So we're at 10:15. I don't know, Tiffany, maybe we'll go through the resources and we'll take a few questions.
Please.
Yeah.
So can you just stop sharing yours? And I'm going to put up my. So we want to share with you, the OHC has been created a bunch of the information sheet on our website. It's called Protecting Workers from the COVID-19, the grocery workers, store workers. This is the information is talking about how should the grocery store worker be protected during the pandemic. So like, for example, to avoid contact and increase the social distancing for everyone, not just only between the customer and the workers, but also, the social distancing between the workers themselves. And also you can see that what is the clean, more and sanitize and disinfect as needed. Why we have to using some safer products, Geoff and Kim have been talking about, there have been people sanitize and disinfect a lot that we're using so much chemical. So on the resources, I will go through with you after that. And then also, to provide the PPE and the frequent hand washing is really, really important, the hand hygiene. And then what's all the clean materials and work clothes safely. and keep sick people out of the workplaces. Those are, really, really important workplace practices we have to keep in mind during the pandemic. And beside that, there's some other resources we have been created on our website under the COVID-19. So those are the resources for the healthcare, income support, rent payment, emergency housing, food support, domestic violence. Beside that, we got the resources for the workers' mental health. Kim and Geoff had talking about anxiety, mental health to supporting workers is really, really important during the pandemic. Social distancing, at home economics, information sheet for the essential worker. Beside the grocery worker we have been creating, we also have the cleaners, the food processing workers, and the security guards too as well. And then the safer cleaning practices for the workers. I put it up on the chat box earlier. So this is really, really important to using the safe products to do it. And then how we using the workers' rights to protect ourselves during the pandemic. And then the last but not least is the ventilation resources. So you could visit our website for more information on that. Now we'll be going to our Q&A, right? So I have already put up the comment and the question from the audience. I'm going to share on the screen here. So first of all, we get it from Gretton. This is his question.
Okay, so Grattan asks, how many CBAs have language addressing pandemics as a possible emergency and what to do during one? Will this pandemic affect future CBA language? So currently, I don't know of any CBAs that have language addressing a pandemic.
No.
As Kim said,
I'm not familiar with any of our collective agreements under 832 that deal with that. Like I said, a lot of them refer to instances of force majeure. Right. But I mean, we've never really challenged it. I don't know. I think force majeure has a pretty...
And that's just like pretty much if a worker can't report to work because of a storm, yeah, or they need people to stay longer because workers can't come in and replace them, right? That's yeah, really all we have. Exactly. I really hope, though, the second part of your question, Grattan, is that will this affect future CBA language? I hope so, and that's up to negotiators and unions to push for that.
Yeah, I do believe that it's, being in part of some of negotiations that are currently going on, we have addressed that, and the employer's been quite responsive. So whether we actually get it into the collective agreement will be a whole other story. We're working through it right now, but they certainly haven't said no, they're willing to work with the union on that. But hopefully it's not, who knows, right? Because all of our major retailers are going into negotiations over the next few years. So, and a lot of them don't want to be the first one to have that, so we'll see, hopefully, but it certainly is going to bring up a lot of discussion at the bargaining table.
Unfortunately, we don't bargain Safeway or Loblaws for about a year and a half.
2022, I think, is Safeway's agreement, so.
Torin asked, have you heard of any instances among your members where there was a legitimate work refusal as a result of a positive test result in the workplace?
I do not.
No, I do not know of any instances. The positive tests that we have had are usually people who went to work, felt ill, so they did not return to work the next day, which is the right thing to do. And then after continuing to feel ill, they went to get a test and tested positive, and then informed their employer. This was usually once they got a positive test result, was 4 or 5 days. One instance was 10 days after their last shift. The employers both usually respond pretty well by cleaning the area that member last worked. But unfortunately, when they find out 10 days later, cleaning and sanitizing is almost a moot point because there's already been shifts for 10 days at that point. I haven't had anyone call me say their work refusal was denied for working with someone who has come back from a trip or recovered from COVID and come back. Mm-hmm. We did receive a lot of concerns early on, especially throughout the summer, from people going on trips and then coming back to work. And then we got questions. Well, do I have to work with that person? They went to Calgary. They shouldn't be back at work. And that was at the time when travel to the West, I think West during travel is still allowed, but there's what we saw that was the biggest concern was people who traveled within Canada. You know, I heard they went on this holiday. I don't want to work with them. That's what we got. That's what we got a lot of.
And also a lot of members asking, you know, if there was someone who you know, if you're working in a small department, say for example, a deli, it's pretty easy to figure out through the process of elimination who the individual is that is not at work and is going to get tested. Because, you know, obviously those folks that may have worked with that individual will also be notified of that. More of the issues we've had or I've dealt with is people wanting to know what those test results are, who it was, why wasn't absolutely everybody notified? You know, it's trying to manage a little bit of that and explain, well, you know, you're not really entitled to know that information. You just need to know what you need to do to keep yourself safe at this point. So that's been interesting.
When we got a confirmation of a positive case in a store, we would not, our information would not contain the member's name, but we would tell our members that yes, we've been informed of a case in your store. This is when the person last worked, and this was the shift they were on. So people can usually, depending on the size of the store, the department can figure it out. But it's, you know, we do try to maintain people's privacy, which they have a right to, and they absolutely do not have the right to see someone's test results, which we've had demands for in the past.
And I think that's, you know, that just boils down to, again, shows the heightened level of anxiety and fear, right? You know, when it's, you never, when it actually hits home, whether it's your department or whatever, that's when it really escalates. And I think that's a lot of it, you know, that's where it's driven from. But yeah, that's been a challenge too.
Rob asked, have there been known cases of employees getting COVID-19 traced back to their work? I personally had one where it was traced back to a night crew, and all the employees that worked with that person on the night crew stayed home. Pardon me. We're asked to stay home, monitor, self-isolate, and get tested if they felt sick. That was the only one that was traced back to a crew. That was the whole crew was asked to stay home. Most of our positive cases are people, like I said earlier, who felt ill after shift, didn't go back to work, continued to feel ill, and got tested and turned out they were positive.
Yeah.
Pepper asks, the complaints we received from the public, were they advocacy complaints for the workers, or were they worried about their own needs? Both. Yeah, I'd say it was both. There was obviously personal concerns, concerns for their colleagues, concerns how their store was handling the pandemic, concerns, and quite frankly, concerns how their union was handling it. We sent out a survey to ask our members, you know, a few months in, how they thought we were responding. We got positive responses, but there were some people who felt we could do better, and that's criticism that we need to receive and act on.
Yeah, I'd have to agree with you, Geoff. I think, you know, any of those advocacy complaints that came in, it was definitely for the workers, but also for their own safety and health going into those environments.
A lot of people the biggest thing we heard was, I'm not immunocompromised, but my husband is, or my wife is, or my kids are. And that was, and that was the biggest, we heard a lot of. Grattan says it's impossible to determine if there's an immediate risk for right to refuse situations. In this case, the employer is responsible for assessing risk to workers. But how do they do that when the customer may be the risk? Employer can't possibly assess each customer before they enter the store. Yes, you're right. We did have a Safeway did roll out a pilot program at one store where they were the customer had to volunteer, but testing their temperatures. They thought that was something they tested at a few stores across Canada because they thought that was going to be something the government would quickly impose or soon impose, testing temperatures. So they wanted to pilot that. And that's an example, again, of a company like Safeway being proactive. They said, look, we think this is coming down the pipe. We want to try this, so we're prepared. Yeah. Kim, I don't know if you want comment there or.
No, actually, I'm sorry, I was distracted because Grattan had mentioned that there was actually more to that comment.
Oh, sorry.
It sort of scrolls down, and I'm trying to scroll, but I don't have. It's very strange.
You said it was mostly a comment.
Your mouse.
Okay. All right, so let's go to the next question there, Tiffany. Will we have time. I think it's from.
I just put up the more comments from Gretton's here on the stream.
Grattan's right. I agree. But that was our, like, quite frankly, that was our frustration, right? The customer and the public is the hazard, but they're also the reason that a company exists or that an employer exists. So, you know, they did their best. In some cases, they could have done better. In some cases, best practices fell by the wayside when they, like I said, got in the way of profit making, unfortunately. Rob asked another one. In late summer, news from Brandon was about some racist sentiments and behavior targeting non-white Maple Leaf employees in the community. Were there occurrences in grocery stores targeting employees that you heard of?
I didn't hear of any in any of the stores. Yeah, Maple Leaf was that escalated really quickly out in Brandon for sure. But I didn't hear of any of those types of incidents happening here at any of the Winnipeg stores or even some of the outer communities that I deal with as well.
You know, again, it didn't come from colleagues, but it was the public. The public, you know, definitely heard some instances of racism from the public towards members of color, especially depending on their country of origin and where the height of the pandemic was at the time. Yeah. That's the kind of stuff that just gets you down, and you almost wish you were in the store when it happened so you could punch that customer in the face.
You lose faith, lose faith in humanity a little bit when you hear those types of things.
Yeah. Are companies looking at customer incentives to download the Health and Safety Canada app, tracing app, IG discounts if they show they download the app? No, I haven't heard of that. That is awesome. That's a great idea. Make an incentive so that they have the tracing app, considering the work they're in. No, thank you for that. That's
something for us to take back to the employers.
Yeah. Anything else? Or do we miss something? Did someone feel their question didn't get answered? I want to thank everyone for coming this morning. We are the reps of the members who live this. Last night we had a lot more of our members present listening to this. I hope we did right by them. They're the ones on the front lines. We're their support system behind them, and we ask that you support them when you're shopping. If you see someone getting frustrated with them or frustrated with the measures that are in place, say something, right? You don't got to get into a physical confrontation, obviously, but please say something, support them. What we hear a lot is that goes a long way. When I was getting grief from a customer and another customer said, hey, back off, they're doing their best, or hey, cut it out. Just that goes such a long way. You don't understand those messages of support, or just thanking them for being there, because they're burnt out, they're tired, they're dealing with this just like us, and we're in, like I said, we're in for this for a little bit longer.
Yeah, absolutely.
So on behalf of the Occupational Health Center, we are so honored, and so thank you, Kim and Geoff, for doing such a great informative session, sharing all your great work experiences, supporting the workers, and then, but also thank you all the audience here to join us, spending with us for an hour, to listen to the presentation. So the session has been recorded. So is anyone missing the session? We will try to post it on the social media and the website, hopefully sometime in a week or two. Then you can share for anyone that missed the session. Once again, hope you're all staying well and safe, and then have a good weekend, and see you next time. Thank you.
Thank you, everyone.
Thank you.
Bye, everyone.
Appreciate
Bye, Grattan.
it.
Bye, Torin.
Take care.